family history is something which is important as it is being told while diagnosing HAE. But from your clinical expertise, I would love to understand how much it is important, family history, alongside with all the tests which you have mentioned.
So, family history is extremely important when it comes to any branch of medicine. It's history, history, and
Yeah.
history. Okay. As someone in the entertainment industry, it would say entertainment, entertainment, entertainment. We would say history, history, history. So, what that essentially boils down to is figuring out, have there be other family members who have had
Mm.
similar episodes, parents, grandparents, uncles, aunts, cousins, depending on the, first degree relatives is what we would look at.
Okay.
And it's important because some of these individuals have a history where someone in the family, after a relatively minor car accident, died at a very young age, or someone very close to them during childbirth died due to unexplained reasons, what they thought might have been a drug reaction or something, or someone who has had recurrent episodes of swelling which have been blamed on having an allergy or blamed on having an insect sting. So, delving into people who have recurrent abdominal pain, recurrent swelling, sudden deaths in the family, family history is extremely important. Up to 75% of patients may have a family history that is relevant and shows that others are affected, because it is an autosomal dominant disease, which means it's inherited with a 50% chance of the offspring, the child of the person having it, capable of having the disease. That's a 1 in 2 chance.
And then the number increases in the
Absolutely.
family.
Absolutely. As more and more family members down the generations go on and it gets inherited 1 out of 2, 1 out of 2, the chance of having multiple affected family members goes high, which is why we always recommend doing something called family screening. So, if one individual in the family gets diagnosed, we generally recommend all their first degree relatives to undergo the 3 tests that I mentioned earlier.
And then explains the severity of this disease or the prevalence.
Absolutely, because and that's where the entire role of genetic counseling and counseling comes in, because this disease does not always present very early in life. In fact, the average age at diagnosis of an individual having this, which has been there since birth with them, is between the ages of 10 and 20, 25. So, the first 10, 15 years of life, they may go with thinking that these are other causes, or they may have very little symptoms. So, becomes very important to prognosticate, give them the future chances of what this disease can do, what the symptoms can be, what can get better or worse, all of those things, and what precautions have to be taken.
So, sir, coming to the treatment part of HAE, who should be there as the caregivers for those patients? Can it be dermatologist? Can it be pulmonologist? Or can it be any gynecologist or genetic counselors who can be the best fit for HAE patients?
So it's a very interesting question, Dr. Someshwar, because I'm an allergist, immunologist, and asthma specialist. So clearly, an allergist, immunologist is who very often diagnoses these cases, because they come to us with swelling, thinking that they have an allergic problem that's causing it. But in reality, this is a disease that anybody could be seeing. So if a gynecologist is seeing it with a patient who's during their menstrual cycles, or a lady who is breastfeeding her baby starts having this because of the minor trauma that breastfeeding may be causing. So a gynec may be the first one to see this case. A dermatologist could see it just like we as allergists see it, because the patient may go to them thinking that they're having some kind of an allergy or reaction. Similarly, you would potentially see these patients go to a pulmonologist because they are having a cough during these episodes of swelling, and they think that that may be related to their lungs. These patients may go to a gastroenterologist because they are going repeatedly to the hospital or emergency room with severe abdominal pain, which has sometimes ended up even in surgery and not being able to find anything other than swelling in the intestines. So I think that this is a disease that I think all common practitioners need to know about. They need to be able to identify, be able to screen and diagnose, and then eventually they can send to a specialist or a super specialist who is well trained, like an allergist immunologist, to manage this condition on a long run.